Koons, you've had a long career in medicine, and what do you think is the secret to having a long and fulfilling career in the medical field?
Okay. We've talked about the need to deal with the patients as a human being. And if you deal with patients as a human being, you can look at what their needs are, plus what you see from the scientific standpoint. So you can then incorporate their thinking of what they want out of this healthcare, what they want me as a professional person to give them, and blend that with what the best evidence medicine can provide, and modify one or the other as we need to find a common goal for the patient. If we do that, the patient is satisfied and I'm satisfied because I'm doing what I can do scientifically. So it's getting to know the patient that's important. Burnout is a common problem among, particularly among family physicians and geriatricians, if they're not careful, because you have so many negative things that are happening. But you have to set a realistic goal for yourself. If your goal is to cure cancer patients, you're going to fail in a good percentage of cases, and if you're not ready to accept that, then you will not be happy with that practice because you'll be constantly failing in your eyes. But if you say, can I make the rest of this patient's life worthwhile? Can I add some quality to this? Can I walk their path with them even though we don't succeed in anything? If I can be there with them, that's a great gift I give the patient. That's my goal. Now I set a realistic goal for myself. I can accomplish it, and so every patient, whether they die or whether they don't get well, whatever, I can still feel like I've got, I can go home at the end of the day and say, I've had a good day, a good life. So you need to be honest with yourself. Don't set unrealistic goals.
Should you try and leave your work at work when you come home, or?
Well, you know, I wish I had learned this years and years ago, but now I would know what I should have done. What I should have done at the end of the day is kind of think through my patients and say, what went well, what didn't go well, and why do I think it didn't go well? Did I fail to do something, and why did I fail to do something if that was the case? Or did I set a goal that I shouldn't have set for that patient, for me to do something for that patient? And maybe I need to just back off and say, okay, that goal was unrealistic. As soon as I do that, then I take away the negative part of that part of the day. And at the end of the day, I'm fine. And the other thing I realized, and I didn't do this, my wife raised my two boys. I wasn't there for them. I was devoted to medicine and my patients, and I was brought up that way. I was told by a pathologist when I was in my pre-med days, he said, medicine is a jealous mistress, she'll have no others. I don't think he's right today. I think I should have had family life as well as patient life. But I really spent all my time concerned with my patients. And my wife did a super job in raising these two boys and incorporated me wherever she could, but she also gave me permission to not be there, which in hindsight maybe I wish she hadn't quite been so generous and thoughtful. So you need to take care of yourself, and you can do that two ways. One is to make sure you enjoy your family and the rest of your life, but you also need to be sure that the practice that you do, the things that you do in your profession for that day, are bringing some satisfaction or understanding why you didn't, so that you can move on and improve.
So the balance is really important.
Yes, balance is very important.
Well, Dr. Koons, thank you so much for being here with me today. And
great pleasure.
It really is. Thank you so much. Thank you.